Okay, so now we're getting ready to do joint movements. Um, so if you're gonna do movements generated by muscle contraction, but if muscle's gonna make something move, it usually, not always, it usually attaches to a couple bones, and you got a movable joint in the middle. And these terms describe the attachment point of the muscles, how much they move. So the origin, cut and paste, is the immovable attachment point of a muscle. We'll do an example on the next page. So the origin is the immovable attachment point of the muscle, or the less movable. You can just say immovable if you want. So it's not going to move when the muscle contracts. It's going to be like the anchor for the movement. The insertion is the bone that is going to move. So there's your movable attachment. All right, then after you get that, flip the page. So here, guys, for example, the biceps brachiae. The biceps is what everyone just calls the bicep that's in your arm. So you'll see later there's another biceps in your leg, but you know when you flex your arm, when you bend your arm, that movement is caused by the biceps muscle, but it attaches to two different bones. It attaches to the scapula. Here, I just wrote O for origin. If you guys want to write out origin, the origin's the scapula. So when you bend your elbow and you flex your arm, your shoulder blade doesn't go anywhere; it stays put. That's the origin. What moves, your forearm moves up towards your upper arm, but the way it actually does that is by pulling up on the radius of the thumb side bone on the lower arm. So the insertion's the radius. It's the radial tuberosity, to be picky. But okay, so types of movements produced by joints. We got angular movements. Angular movements change the angle between bones. That's why they're called that. I'm gonna kind of tell you not to go off that. It gets a little I still get confused on these angular movements, but it says, like we just talk about flexion of the elbow joint, and people just kind of know what that is usually, but it's like bending of the elbow joint. But it says flexion is movement that decreases the angle between bones. It's movement in the sagittal plane. So remember, sagittal plane is when you move straight anterior to posterior, when you chop someone into a left or right. That's kind of important. So it's sagittal plane movement. If you don't remember sagittal plane, go back and look at chapter 1. But like when you flex the arm with the biceps. So this picture here is showing you the angular thing. So here's he's bending his elbow there, flexing the elbow, and here's so if his arm was like straight out, like if it wasn't bent, if it was like straight like here, then that angle, a straight line, the angle is 180 degrees. So, but he's bent it a little bit, so like now it's like, I don't know, what is it? It's going towards 90, 80, something like that. So it went from 180 to whatever that is, 100 degrees or something like that. So it decreased the angle between the joints. It flexed it. So here's what's confusing about that to me. I mean, that's an angle 180 degrees if his arm is straight. But that's an angle too, and that angle actually increased. So as far as how you root those angles, it gets kind of confusing. I still get totally mixed up on that. So here's an important hint, and this is kind of what I go off of. When you see flexion is movement away from anatomical position. If you guys don't remember anatomical position, go back and look at chapter 1. So remember, you're standing straight, arms down to the side. Your arms are straight, right? They're not bent in anatomical position. And again, if you don't remember it, go back and look in chapter 1. All right, so flexion is movement away from anatomical position. That works every time. This works really well too. I keep saying like it's bending. If you're bending something, especially a limb, it's flexion. All right, go to extension. So it's movement that increases the angle. It's also in the sagittal plane, but again, I wouldn't go with that. I'd go with this. All right, extension is movement back to the anatomical position. Or for a limb, it's going to be the straightening of that limb. All right. Hey guys, one thing you want to do for sure is find this lady in your book. There's several pictures of her. She's in the blue, like, a unitard thing, but she's doing all these different movements. Definitely find that picture. All right, so check out what's going on in these. So remember, in anatomical position, don't worry about the legs are straight, so the bottom half of her over here is like basically an anatomical position. So here we've got bending of the knee. So that flexion. Also, if you think of it as going away from anatomical position, your legs are straight when you're in anatomical. It's not bent. Flexion. Now, where flexion and extension gets less clear to me as far as bending and straightening is like with the shoulder joint here. So if you check out our shoulder, it's moving anteriorly. It's not clear to me what's bending and straightening about this, but what is clear is that is away from anatomical position. So over here, the shoulder joint's in anatomical position, right? Her arms are down to the side. Her palms aren't face forward, but don't worry about that. All right, so the arm's straight down to the side in anatomical position. Here, she moved away from anatomical position, so she flexed it. Now here, on this side, her arm was up like that, and it moved back to anatomical position, so that would be extension. Now, no, I'm not going to try to trick you up with this, but some joints can hyperextend. You've heard the term hyperextend, and that's kind of what she's done with the shoulder right here. She's extended it beyond anatomical position. All right, so there's flexion and extension. Can't find my notes. There we are. Oh, for the foot, dorsiflexion and plantar flexion. Again, dorsiflexion is, look at the pictures in your book, guys. It's dorsiflexion is when you go toes up. Plantar flexion is toes down. Let me see. I had a picture. Oh, wait, here. While I'm looking at pictures, there's another flexion and extension. Bending, flexion, extension, straightening. There's some more flexion and extensions, bending and straightening. Here's dorsiflexion and plantar flexion. So here you can see, remember I said plantar flexion. I think did I say it backwards? I might have said it backwards. Dorsiflexion is the dorsal part of the foot's the top part of the foot. So the toes go up. The toes move superiorly. And plantar flexion, the toes move inferiorly. So check that picture out in your book. There's a good close-up of that if that's kind of hard to see for you guys. Okay. Abduction and adduction. These two are easy to get mixed up. They sound so similar. Actually, they're one letter off. So abduction, abduction. Ab means away, like abnormal means not normal, away from normal. So abduction is movement of a limb away from the midline of the body. So it's also done in the frontal plane. But one way to think about this, it's lateral movement, and adduction, adduction, is movement of the limb toward the midline of the body. It's medial movement. So again, look for pictures of doing this. So here, remember, we said abduction away. So here he's in anatomical position. It's another way to think of it. Abduction is movement away from anatomical position. So his arms are down to the side, and then he's lifting them laterally. Abduction. And then here his arms were out to the side, and he's bringing them back in medially, or back to anatomical position. He's adding them to the body is kind of one way to think about it. He's adducting them. So abduction away, adduction toward the midline of the body. Circumduction is a circular movement. Like if you playing softball and you wind up and pitch. Here we go. I know it's a small picture, but there you can see at the shoulder joint, she's doing a circular movement. Kind of makes it like a cone-like sort of pattern, but circumduction. Circum, like circumference around a circle. Here, I didn't do examples here. Like the shoulder, just right at the shoulder there. That's a good one. The hip will circumduct too, if you want to do that. All right, rotation. Rotation's rotation. It's moving a bone along its long axis. Like the Earth rotates, it spins, spinning sort of movement. So an example, the joint between C1 and C2. Guys, and if you don't remember who C1 is also known as? If Atlas just popped in your head, then good. And if it didn't, then circle that and write Atlas down here. Remember, C2 is the axis. So the joint between C1 and C2 is what you use when you say, no, I'm doing it right now. When you shake your head, that's a rotation of C1 on C2. This is also rotation, but it's rotation of the forearm, the antebrachium, the forearm. Supination and pronation. Again, you want to do pictures in your book here. Supination is palm anterior. So supination is palm anterior, palm facing forward. Pronation is palm posterior. Here. So if you look at this lady, the palm forward. So also it's in anatomical position. The thumb's lateral. She's got her elbow bent, but don't worry about that. All right. So there's supination, and then pronation. The palm of the hand is posterior, so you're looking at the back of her hand or her knuckles right there. So supination, palm anterior. Pronation, palm posterior. All right, back to the feet. Inversion and eversion. Again, guys, do the pictures in your book. Inversion is when you turn the sole of the foot medially. So inversion, sole of foot medial. Eversion is sole of foot lateral. All right, so inversion, sole of foot medial. Eversion, sole of foot lateral. I had a picture. Oh, there. Went right to it. All right. There you can see. Sole of the feet are turning in, inversion, and then turning out, eversion. So there'd be the central. It's kind of very hard to tell since you just look at the bottom of the feet there, but there'd be the central axis of the body, so those feet are turning in. Okay. Some others, elevation and depression. Here, let me start writing one of this stuff out. I've just been kind of talking because I'm. All right. Protraction and retraction is not it's not an angular movement, it's a linear movement. So protraction and retraction are linear, anterior, straight forward, and retraction is posterior movement. Oh wait, here, don't put that there. Put that there. That's the definition. Now if you want an example, do the jaw. That's the one your book does, and I had one too when I was looking for pictures. I saw it's that guy's. Where'd the guy go? I lost him. There he is. Sort of the jaw. So remember, we said linear, straight line movement. So protraction of the jaw moving forward, retraction of the jaw moving back. All right. Here's another one for the jaw, for an example. Elevation and depression. This is also, it's basically linear movement. I mean, it's not like fancy words. Elevate and depress, up and down. Superior and inferior movement. So, and if you want an example for that one, like you can do, like the jaw is good. Like when you bite, like when you put your teeth together, you are going to elevate the mandible, and then you open your mouth, you depress the mandible. So, for example, jaw. When you can, I don't know how you want to consider a joint, but you can also do like when you shrug. When you shrug, your shoulders go straight up and straight down. That's elevation and depression also. All right. Opposition. You probably heard you got opposable thumbs since you're a primate. Opposition is movement of the thumb to the palm, opposite finger. That might be a little bit different than the definition you get in your book. So movement of the thumb to the palm, opposite fingers. So this guy is doing some opposition. So the thumbs are going in toward the palm, but the fingers can go into the palm too, but they would move down that way, not in that way. So maybe not exactly opposite, but pretty dang close to coming in from the opposite direction. I guess there's all sorts of this joint movement stuff on the next test, so hit that section pretty hard. All right, that's it for this part.